would like to start with a short introduction on feline immunodeficiency virus and feline leukemia virus. And then Michelle, actually her name is Nikki, usually name we use is Nikki, will give an update on FIV and FeLV in shelters. And we have kept it, just short presentations because we really would like to have some nice discussions and questions. We do have enough time for questions. So please feel free to ask questions. Please write down your questions so that we can answer everything that you want to know afterwards. Okay, I would like to give an update or just an overview on those both infections and specifically on pathogenesis, transmission, very shortly on testing, because Nikki will also go into testing a little bit, and management, general management, a little bit of antiviral treatment, and I will do that for both infections. First of all, I would like to draw your attention to ABCD. ABCD is an advisory board on cat diseases, a European advisory board, and we are 19 specialists from different European countries, and we develop guidelines since 15 years or 18 years now. We develop guidelines on every feline infectious disease you can imagine. We have more than 60 guidelines on our website, and you can download them. They're all there, all in English. We also have fact sheets, so very short summary on all these diseases. So please visit our homepage and download detailed information on all infectious diseases. I think it's really helpful. We try to keep them up to date all the time. So, feline retrovirus infection. Retroviruses, this is a certain group of viruses. HIV is also a retrovirus. And there are certain retroviruses in cats. There are 3 different retroviruses in cats. This is FeLV, FIV, and the feline foaming virus. We will not talk about this virus today because this virus, or it's also called feline syncytium foaming virus, we will not talk about it. Not because it is so rare. No, it's not rare. It's very, very common in the feline population, but it does not cause any disease. So that's a very successful virus. It does not cause any disease. It's just there. Almost every cat is infected. Virus is happy, cat is happy, everybody's happy. So, but it's not important for us because it's not causing disease. A little bit more pathogenic is feline immunodeficiency virus, but we know now that it really does not make cats very sick. It's much less pathogenic than HIV. It's less pathogenic than FeLV. Many cats can live wonderfully with FIV infection. And then the most pathogenic one is feline leukemia virus. But still, there are many cats that are infected with FeLV that do not have progressive infections, or they have a latent infection, a dorming infection, silent infection. They can live with this virus forever. So these retroviruses are not that pathogenic. They commonly do not kill cats, and with the exception of FeLV, they don't kill cats at all. So how about prevalence? How common are these infections? So this is an older slide, but to show you there's a lot of difference in FIV prevalence. So a lot of difference really depending on how many stray cats you have. As more the stray cat population, as higher the stray cat population, as more FIV you will find. Well, FeLV, there's more a balance. However, recent studies have shown that also there is a certain difference between countries, and I will show you that later in a few large studies that we have done. So for FeLV, we know there is a decline in prevalence, which is not the case for FIV, but for FeLV, we know that. So FIV is pretty much stable in the population. So FIV is there at a certain prevalence. I looked up what we find, actually, what's about the prevalence in Portugal. And I found there are 2 different studies that actually show, one is a little bit older, and one was published 3 years ago, that FIV and FeLV prevalence is pretty high. and FIV even higher than FeLV. So this is pretty high prevalences. It's probably highest prevalences all over Europe. Now, as I said, we looked at the behavior of FIV and FeLV over time, and we published this paper that's already 15 years ago, but still what we could show is that FIV prevalence is relatively stable. FIV will stay the same over time, while FeLV prevalence is really decreasing. And FeLV prevalence, of course, can be easier controlled by vaccination, and also by testing. And FeLV, if it's in a population, it might kill cats. So there is that decrease, but this decrease has plateaued now. And now we have also a stable prevalence for FeLV. So we did ABCD, did this really, really nice study. This is a study that we did all over Europe. And we wanted to know FeLV prevalence. We wanted to see, how prevalence all over Europe is. And for this prospective study, we had 32 European countries, and we wanted to detect FeLV viremia, which means progressive infection, progressive FeLV infection. So these are the cats that are also usually antigen positive. And we had 400 cats out of each country, and these were 10 different veterinarians all over 40 different veterinarians out of each country, and each veterinary sampled 10 cats that came into the practice. And so we could look at prevalence, and we found that in the northern European countries and in middle European countries, FeLV prevalence is relatively low, while in the southern European countries, and this includes Portugal and Italy mainly, prevalence is still quite high. So if you look at the different countries, you see, in Germany, we almost didn't see FeLV anymore. You see that there are some countries with a higher prevalence, such as specifically Italy was quite high, Hungary was quite high, and Portugal was really high among the different countries. And we compared that with the vaccination rate and found, okay, the countries that vaccinate more often generally have lower prevalence, so vaccines really help, but it's not a one-to-one thing. And you see Portugal really has the highest prevalence of FeLV all over Europe. Recently, just last year, we published a study in which we wanted to know, not only what's the prevalence of viremic cats is, so these are the antigen positive cats that we detect. We wanted to know how about other FeLV outcomes, such as abortive, regressive FeLV infection. And we looked in 2 countries that have a low prevalence. This is Germany and France, and 2 countries with a high prevalence. This is Italy and Portugal in our case. And we sampled cats in these, in total 934 cats in these countries. And we looked for different antibodies. We looked for antigen. We looked for provirus by PCR. And also for viral shedding. And what we could find is the following. This is our results. You see here progressive infection. Those are FeLV infection. Those are the ones that have antigen in their blood. They are shedding. They are infectious to others, and they will usually or commonly develop FeLV associated diseases. And that is not that high if you look at this. But there's also regressive and abortive and also focal infection. And if you summarize all that, you see that even in Germany and France, there's still in Portugal, it's about 20% of cats that are infected with FeLV, with the different forms of FeLV. And this is still very high infection rate. So overall, FeLV prevalence in Europe is very high, especially in southern European countries. It's important that we know the FeLV status of every cat, and we need to further reduce prevalence by testing, separation, and by vaccination. So let's go a little bit more into detail on these infections. FIV infection, as I said, FIV is not very pathogenic. And when I talk about FIV, I usually like to show the cat Snoopy. Snoopy is the last FIV-infected cat that I saw when I was on clinics. It's a while ago because we do not see a lot of FIV-infected cats anymore, but I saw Snoopy. Snoopy is a domestic short-hair cat, 16 years old, female spayed. Snoopy is single, indoor only, since 10 years. Snoopy came to us because her diabetes was not very well regulated. She has problems with her blood sugar. The diabetes was not regulated. So we had her in the hospital. We found out she was not eating well. Why? Because she also had chronic kidney disease. And the chronic kidney disease make her feel bad because of the high urea and creatinine. So she was not happy. She was not eating. And this is why the diabetes was uncontrolled. So we tried to control the chronic kidney disease by giving her by giving her by giving her fluids, fluid therapy, and some other medications for the chronic kidney disease. So then it became a problem when we gave fluids that she developed lung edema. Why? Because she also had a cardiac disease. She had hypertrophic cardiomyopathy, so the heart could not, deal with all these fluids. So we had to give her diuretics. With the diuresis, her chronic kidney disease became worse. So it was really, really very difficult to control Snoopy. We finally managed to control her between the chronic kidney disease and the heart disease. And then we were also able to get her diabetes controlled. And we were able to get her home to the owner, telling the owner, it is very difficult to deal with all these conditions. So we are not sure how long we can deal with all the different conditions. But Snoopy went home. So, by the way, Snoopy also had FIV infection. And this FIV infection was known since 10 years. And this is why Snoopy was indoor only since 10 years. Do you think I did care about the FIV infection? I mean, no, we didn't talk about the FIV infection. Why? FIV has nothing to do with diabetes, chronic kidney disease, or hypertrophic cardiomyopathy. This is totally unrelated. This cat has FIV infection, yes, but it has been managed well. It has been indoors only. It has been given good care all the time. So FIV is not the problem of this cat. And I see many cats like that, This cat is sick, but it's not because of FIV. And this is what we commonly see. Many cats with FIV do really well, and they really die from totally unrelated reasons. In 2009, we did a study in which we wanted to see, we looked at the survival time of cats with FIV, FeLV, and negative cats. And here we compare FIV positive and negative cats, and it looks like that FIV positive cats even survive longer. This was not significant, but there is no difference. They survived. They have the same life expectancy than non-infected cats. This is different to FeLV. In FeLV, the survival time is shortened. They still can live a good life. They still can be happy and healthy, but the survival time, the survival lifespan is shortened when compared to non-infected cats. So FeLV is more pathogenic. So for FIV, how is the prognosis? We cannot cure FIV infection. A cat that's infected will be infected lifelong, but FIV infection is not a reason for euthanasia. Cats can live with this infection and they can live a long and happy life. And this was also shown in this study. Julie Levy did this study in the United States, and she showed the same thing. FIV did not reduce survival time. And also this study in Australia, they looked also at cats with FIV infection, and there was no negative effect of FIV on the survival of these cats. So we know FIV is not very pathogenic in cats. So how about the clinical signs? Many times we see cats that do not have clinical signs, or if they have clinical signs, it's maybe not caused by FIV. It's caused by other diseases. And there can be immunosufficiency, and then there can be, sometimes unusual infection, or there can be other diseases, tumors, neurologic disorders, immune-mediated disease, but those are rare. Usually, FIV does not make the cat sick itself. There can be immunodeficiency with a reduced, especially of CD4 positive cells, and then there can be a higher risk of infection, such as different infections. One example is feline chronic gingival stomatitis that we sometimes see with FIV infection, and yes, we see it more common than in other cats, but we can treat this disease. Chronic secondary infection, there can be herpes virus, calicivirus, there can be other infections, but these are treatable infections. They can be treated, even also in an FIV-infected cat. Then sometimes there are some unusual infection. This is candida infection in the oral cavity of a cat with FIV infection. This is a chlamydia, genital chlamydia infection in a tomcat, which is very unusual. Chlamydia we usually only see as conjunctivitis. So this can happen and it's very unusual. And because the cats are immunosuppressed, these cats also have a certain higher risk of tumor development. So it's known that it's about 5 times higher risk to develop tumors compared to non-FIV infected cats. And very few times, really only sometimes, cats with FIV infection can develop neurological disorders. But this is really rare. Usually, secondary infections are more responsible for neurologic signs in FIV-infected cats. Sometimes there's also an overreaction of the immune system on the FIV infection. We sometimes see these cats have hypergammaglobulinemia, can have immune-mediated disease such as glomerulonephritis or uveitis, but again, not very common. And in earlier times, this was one of the first cats with FIV I saw. This was really an emaciated, poor little cat. And we thought, oh my God, this cat is FIV infected. So this cat is very sick. But today I know FIV does not cause something like this. There must be any secondary or unrelated condition, and we need to find the secondary or unrelated condition, and we need to treat it. It's not FIV itself. So how about transmission? Transmission is usually caused by aggression. So most commonly bites, biting, fighting. This is most important. This is one of the first FIV cats. FIV was just found in California, and we had like the first cats with FIV infection. Here you see this is a fighting cat. It lost its ear in a fight with the neighbor dog. So usually bites, rarely blood transfusion, rarely sexual contact. Everything else is not that common. It's usually bites. And it's not transmitted. It's only few minutes survives outside the body. So there's no indirect transmission. The cat have to be together and bite and fight. So testing. Just very shortly, we usually use in-house tests such as a SNAP test, and it detects antibodies. And it's very important to realize this is an antibody test. Why is an antibody test useful to diagnose this infection? Well, because all cats develop antibodies. So we do have antibodies in all infected cats. And on the other hand, because this infection is lifelong, there's no cure. When I find antibodies, FIV antibodies in an adult cat, then I know this cat has FIV infection because it cannot get rid of it. There are a few exceptions, and this is important. So if we find an FIV positive cat, this can mean the cat has FIV infection. It can also mean that these are maternal antibodies, and it's very important. In kittens up to 6 months after birth, this can be maternal antibodies. And so this kitten is not necessarily infected. It also can be caused by vaccination in countries where the vaccine is available. Not important for us, but we have to remember that. And it also can be a false positive test. And false positive tests are not that rare. They are much more common than false negative tests. A negative test can indicate that the cat is not infected, or false negative, but this is really rare. So we usually believe the negative test results. So when do we need to retest? Well, when the prevalence is not very high, we always recommend to retest if there is a positive test result. Or we also we also recommend if there's really, if a cat that is very sick and is positive, if this cat would be euthanized because of a positive test result, we always recommend to repeat the test. Cats with negative test results, we believe. However, if there's recent infection, it may take 3 to 6 weeks until the test comes out positive. So if recent infection is possible, we would also recommend to retest after a quarantine of 6 weeks. So, take-home message, FIV is excellent for detection of antibodies, but positives should be confirmed. How about management of FIV infection? There are also some online, these things are online available. I just did one overview how I treat feline retrovirus infection, and there's many things. If you are more interested, this is online available. This is from Clinician's Brief. And there I did in 2012, and it's still very, very relevant. And there I really showed when I really treat FIV infection. And usually I don't use a lot of antivirals. Usually, if no clinical signs are present, I do nothing. If they are present, I always look for underlying diseases first, because FIV itself is many times not responsible for the clinical signs. And then I treat the underlying diseases. I treat stomatitis, I treat, also in cats with neurologic signs. I first look for an underlying other disease, secondary or unrelated. And then if there is recurrent infection, sometimes I may consider treat with some antivirals such as sidovudine. And here another one that's also an update. It's also online available from the Feline Medicine and Surgery Journal. How I use antiviral chemotherapy for retrovirus infected cats. And here again, a very, very big overview on efficacy of antiviral drugs against feline immunodeficiency virus. You can download all these articles if you want. So just very shortly, there are 2 ones that we use sometimes. One is ACT. This is a human drug that's used for HIV, the first one. And we sometimes give it to cats in few occasions. This is the dosage that we use, and there are some side effects, mainly myelosuppression. So we have to control the hematocrit in these cats when we use sidovudine. And it inhibits the reverse transcriptase, the enzyme, so it's a nucleoside analog. And it blocks the active center in the enzyme reverse transcriptase, and this is how it works as an antiviral. So in one study that's very long time ago, we could show there is some effect. So the stomatitis was decreased, the Kanofsky score was improved, and the CD4-CD8 ratio was improved. So there is some improvement in these cats, but as I said, usually, and this is again important, control hematocrit if you use it. But usually, there's really few exceptions that we really use antivirals in cats. The other one is interferon. Interferon, there are human and feline interferons. Since we have feline interference, human interferon is not used anymore or not commonly used anymore. In the United States, there is no feline interferon omega on the market. They still use human interferon alpha. So there are very few side effects for feline for interferon. It's used for virus infection, for different virus infection, and also has been used for FIV infection. Now, we don't have a lot of really good prospective control studies, unfortunately. So it's very difficult to make an assessment if it really is working. There is that one field study from the company Virbac who looked at 110 cats, and when they compared, then they treated cats with interferon or they treated them with placebo. And when they looked at FIV-infected cats, there was no influence on survival rate. However, there was some effect on the clinical signs. So it did not really, probably did not influence FIV, but maybe influenced the secondary infections. And very interesting, out of Portugal, from northern Portugal, there are some studies in which they also looked for, efficacy of feline interferon omega as immune modulation in FIV positive cats, and they used it in shelters. I'm sure you know these studies. And, this is also a very nice summary. And I think you can summarize that if you use FIV, interferon omega in shelter situation in retrovirus or FIV infected cats, you will see that there is a reduction of clinical signs. And it was shown that there's a reduction of co-infection because the cats do not shed anymore. But it does not have an influence on FIV or FeLV itself. So it's probably good for the co-infections, but does not influence FIV or FeLV. So take-home message, FIV treatment. We do not use any treatment in healthy cats. If there are cats with clinical signs, we sometimes use cedarwoodine. Sometimes we use it in cats with stomatitis or neurologic signs. We also might think about in cats with secondary infections to use feline interferon omega because it might have a positive effect on the outcome of, for example, respiratory virus infections. Okay, so that was FIV. Now let's go to FeLV. FeLV, as I said, is a little bit more pathogenic. So FeLV will indeed reduce survival time. So cats can get very severely sick when they have FeLV infection. They don't have to, but they can. They can get severely sick. And also that study in the United States showed that FeLV significantly reduces survival time. Again, there's also no cure if a cat has progressive FeLV infection. Many cats will die after several years, but there are also cats with progressive FeLV infection. They can live a happy and long life. And so just because a cat is infected with FeLV, it does not mean we need to euthanize the cat. So FeLV is a little bit more complicated. I don't want to go too deep into detail because that's too much for today. I'm happy to talk about all the details at another time, but just to let you know, there are different stages. There is progressive infection, regressive, focal, and abortive infection. And the only ones that really, really get sick are those with progressive infections. They are positive for FeLV antigen. Regressive infection, the virus is going back into the bone marrow. The viral genome is integrated into bone marrow stem cells, and usually these cats are antigen negative. But this regressive infection can be reactivated, and then the cat can get sick. Focal infection is very rare. Sometimes infection is in the mammary gland or only in the spleen. So these are cats that have discordant results. And then there is abortive infection. These cats do not have antigen. They do not have DNA or RNA in their blood. They only have antibodies. So these cats have a very, very low-grade infection, and they are very lucky because they are probably protected from new infection. They only have antibodies in their body. So many different infection stages. We are really worrying about progressive infections. We are not that much worrying about the rest. So again, here you see abortive infection, regressive, focal, and progressive. Progressive infection is the one in which we have a low immune response. We have provirus integration, lots of systemic viral replication, and usually FeLV-associated diseases. While in abortive FeLV infection, we only see the immune response. So this means when we only look for antigen, FeLV antigen, and this is what we do with our in-house tests, then we underestimate Regina Hoffmann-Lehmann, and we could also show that about more than 10 years ago. Same thing is true for Germany. So if we only look for progressive infection, we underestimate the true infection rates. Because we need different tests. You see, regressive, abortive infection, they do not react positive on our antigen test that we usually use. So how about FIV-associated clinical signs? Many times there are no clinical signs. If there are clinical signs, it can be either tumors, mainly lymphoma. And here you see there's already a 60-time higher risk in FIV-infected cats than in non-infected cats, because FIV itself can directly cause tumor induction. In addition to tumors, there are other diseases such as immunodeficiency, myelosuppression, and neurologic disorders. So the transmission of FIV is also more easy. The virus does not need to be inoculated in the bloodstream. Saliva contact is enough. So social contact, food, litter bowls, grooming, fighting, intrauterine blood transfusion, all this can lead to FIV transmission. And there is one study that also showed that even feces can be infectious. However, this is also, if there's fecal transmission, there's only a very low-grade infection, which only leads to abortive infection. So this is kind of like an immunization that you can do with virus that's shed by feces. Testing, again, we usually use these in-house tests. So a positive in-house test, very important to realize, we detect antigen. Antigen is a protein of the virus. We detect free protein P27. And this protein is only present when the virus replicates, only present during viremia. This means we only detect progressive infection or sometimes early regressive infection. So remember, there are different forms of outcome, and we do not detect all of them. We only detect progressive infection and very early regressive infection. And here you see again, there's not only progressive infection, there are also other infection types, and we underestimate the true prevalence. If you want to know more about FIV diagnosis, and I do not want to go into, or cannot go into detail now, but this is also a decision tree that we created from ABCD. It's online available. It's a diagnostic tool that you can download from our ABCD homepage to help you when you want to diagnose FIV infection and the different FIV infection types. But let's go back to the FIV positive antigen test. An FIV positive antigen test can indicate that the cat, or it indicates usually that the cat is antigenemic or viremic, in a viremic phase. And this can happen all throughout progressive infection or in regressive infection only during the early phase, and then the virus disappears from the blood. Or it can be a false positive test. But it's not in kittens. It's not positive through maternal antibodies or vaccination. There's no positive FIV test in a kitten just because of maternal antibodies. If a kitten is positive, it's truly antigenemic. Very, very important to remember. This is a big difference to FIV. A negative test can indicate non-infected cats or infected cats, but with regressive, abortive, or focal infection, or it can be a false negative test. Now, again, do we need to retest? Yeah, again, in areas with low prevalence. Again, if a positive test was result lead to euthanasia. And then, of course, we have to think about if we do want to have different stages of infection, we need to do additional testing, such as PCR. The test is excellent for detection of free antigen, but positive tests require confirmation. So finally, about the management of FIV infection, again, I can recommend to look up that review that I did, how I treat in the clinician's brief in May 2012. It was published, but it's online available. It's very similar to FIV. If there are no clinical signs, I do not treat, but I keep the cat strictly indoors. If there are clinical signs, I always look first for underlying diseases, different diseases. And then I treat these different diseases. And when there is anemia, I want to see, is there any other underlying disease. I might give blood transfusions. Sometimes if these cats have severe anemia, it can be immune mediated and some respond to glucocorticoids. If there's lymphoma, I treat lymphoma. There's no reason not to treat lymphoma in an FIV infected cats. If there are neurologic signs, again, I look for underlying diseases such as tumor, other infections. If there are any, I treat these. If there are no underlying diseases, then I can consider treating with antiviral drugs. And then if there is cats with recurring infection, then I treat these recurring infections aggressively. And then these are the situations in which I consider feline interferon omega. Okay, again, I showed you this where you can look it up, and then the three compounds that we sometimes use. Cytobudine, I showed you already. It's the same one that we use sometimes in FIV. However, we go to a lower dose because it is myelosuppressive, and FIV infected cats cannot really tolerate it so well. So we only use the low dose for cytobudine. Raltegravir is another nucleoside analog, is another antiviral compound from human medicine. We only have one study, only with 7 experimentally infected cats. And in this study, the compound raltegravir decreased plasma virus load. But when they stopped the treatment, the virus went up again. It is it's used a lot in Brazil. Many people in Brazil, we have a very high FIV infection rate, but we really do not have a lot of studies that support that we should use raltegravir. I have used it in very few cats, but we really would need more studies, and I'm not convinced it really does so much help. Interferon, again, this was the field study that I showed you, and for FIV, they could show when they compared after 9 months the survival time, there was a difference in survival. However, when they looked after 1 year, there was no significant difference anymore. And there, the big question is they did not look for FIV virus load or anything. They only looked at the survival. And there's the big question, did they really treat FIV or did they treat secondary infections? I think they mainly treated secondary infections. So take-home message for FIV treatment. I do not use any treatment in FIV-infected healthy cats. In some sick cats, when I think FIV release is directly responsible for the clinical signs, I might use cytobudine or raltegravir. If cats have secondary infections, you might consider feline interferon omega. Okay, so this was the first brief introduction into FIV and FIV.